or a wonderful woman that's carrying a bag in the hallway, but someone that you went to school with who may not be in your geography, the technology offers you the ability to connect with around your outcomes initiatives or a unique patient care question. And so we pivoted our platform, and that's sort of why I'm in the Valley this week, pitching WebMD and Hippocrates. We decided that instead of going hospital to hospital, why not go where healthcare professionals are going? Why not go digital? So when you're seeking answers to the questions that you have, you tend to turn to what? You turn to the journals, you turn to the librarian, you turn to a pharmacist, you turn to Hippocrates, UpToDate, Micromedics. We're talking to all of these players, and we've developed a widget. It's a feature, it's a button that can be implemented in all of those apps at the point where you have a need. And the whole focus is, if you want to elevate your information search beyond what's available in that static index, you can connect to a person in pharma who's one of your peers who can actually address your question. This is very attractive to pharma because they recognize that their sales model is failing. It's very attractive to these digital content platforms because they're looking for new revenue streams. And it's attractive to us if you can skip, John, if you can skip like 7 slides, I'm gonna get to, I mean, this is basically, it's a question box. I'll tell you when to stop. This is it. Well, actually go 3. Back 3? No, forward 3, I'm sorry. And then that's it. So the question box can be implemented across multiple health platforms, digital platforms. But what's unique about Needle is if you're a provider and you want an answer, you do have to tell us who you are. So some platforms have the identity of the user because you're logged in and some don't. But there's a finite number of doctors and pharmacists across the country, and you're all splitting your time between multiple health content platforms, journals, digital platforms. We're seeking to be the Q&A layer that enables you, wherever you are, to ask a question. But what we get is your questions at scale. And those questions at scale tell us a lot about what you're interested in and maybe what you want to know that you don't even know you want to know. So what we're doing is we're populating a dashboard first. We anonymize and de-identify everything about who you are as a person except for your specialty and your location. And we're able to show all of the relevant questions by keywords that are asked in apps where Needle is the engine powering the Q&A. Pharma loves this because if they're going to be more effective at serving your needs, your real-time needs, it makes more sense to look at real-time user-generated content versus IMS data telling them what prescriptions you wrote 4 months ago. In this situation right here, and then I'll wrap up, we basically showed, when I was with J&J, J&J launched a drug called Xarelto, one of the few new oral anticoagulants to be released in recent years. So we just showed an example, Xarelto and stroke. Okay, so you see a spike. Why could that have possibly spiked? Well, through our dashboard, we can show that there was actually a thought leader at Stanford. This is all hypothetical, but a thought leader at Stanford that was cited in a press report supporting the use of Xarelto. So for J&J, this tells them something. For J&J's competitors, it tells them something. But for the providers that have questions, the key is you get answers from one of your peers. And so that's what Needle is building. Very excited to be here. It feels like I've jumped a lot from chasing folks like this in a volunteer smock to sitting on a panel. So it feels like a rags to riches story for me, even though we're still in startup mode and raising money. Don't think that we've made it. But we're building an amazing team out. Esther Dyson, if any of you are familiar with, she's recently joined our board of directors and committed our first $100,000 for our 750K round. She sees this future that healthcare professionals, I mean, everyone is adopting apps, and there's really no searchability within apps. Google complains about it. They can't crawl your app behavior. When you think about a question box, what's the difference in a question box and a Google search box? They both reflect the same thing, that you want to know something and you're willing to input information. We're seeking to establish a core competency in in-app Q&A. The idea that when you're deep in an app and you have no access to the web, can we connect you to someone that will answer your question? And we're starting with healthcare because that's what I know. It's a deep pain point. I think that healthcare professionals deserve better. I think that patients deserve better. Pharma makes a lot of money, and they should be deploying their resources more effectively to serve your needs. So, thank you.
All right, well, all the best, Sean. All right, the next is a toss-up, so I'm going to let Nancy and, sorry, I'm blocking Gil, figure out who wants to go first.
Sure, we can flip.
Yeah?
Okay, head to tail.
Heads.
Heads.
Starting off with the win.
Great, Nancy.
Okay. Oh, yeah.
Nancy's with Proteus, and we've had Proteus before here on our panels. They have a very interesting technology that's completely revolutionary out of the box, and that's one of the things about everybody on the panel today is none of these are incremental solutions. These are all somewhat disruptive, and they're changing the way things are being done in the pharma world. So, go Nancy.
Hi everyone, my name is Nancy Doherty. I work at Proteus Biomedical. I didn't put my Twitter handle up there, but it's @NancyHD, so put lots of tech stuff up there. But I'm an electrical engineer, and it's kind of unique to have a hardware designer on a pharma panel, which is one of the amazing things about Silicon Valley, and it makes me very excited and happy. Please skip one slide. Cool. So I love technology. Love it. When we were talking about robots, that was fantastic. So enjoyed that quite a bit. And technology right now is really rapidly and prominently changing a lot of things about our culture. But the health field is very resistant to that change for all sorts of entrenched reasons that I'm sure have been talked about in this group quite a bit. But I think health will be the next place to get, full technology makeover. Because electronics are this amazing point where we can build sensors that are small, unobtrusive, wirelessly connected, and most importantly now, very cheap. So instead of relying on our traditional healthcare system, we can start to improve healthcare directly from the consumer side. So as for what I work on, I work at Proteus Biomedical. It's a startup based here in Silicon Valley, and we make medicines talk to your phone. So the heart of our technology is this tiny integrated circuit here. It's about the size of a grain of sand, and it's made completely of thin materials. And we can embed the circuit inside of anything that you ingest. So right now we're putting it inside of medications. And what this lets us do is this circuit can sense what you've ingested and will tell your phone what medication you just ingested and when you took it. So you can get one more. The companion to this is a patch that you wear. It's kind of like a Band-Aid that you wear on your torso. And you just stick it on and wear it 24/7. And this Band-Aid is constantly collecting your biometric data, like heart rate, respiration, sleep stages and sleep quality, posture, activity and exercise levels. Everything that you're doing, it's reporting that. And all of this uploads automatically to a smartphone and is processed further on our servers to get more meaningful metrics out of it. So when you're using the system, you get a full picture of both your health and your health habits, and a continuous data stream showing whenever you're taking medications, all of your ingestions, as well as the biometric surroundings for them. Let's see. Maybe a little more. Cool. So this technology and a lot of technologies that are popping up like it are really making a transformation in the health field. So one for Proteus jumps right out. We can track your medication adherence, which is useful for everything from pharma R&D to consumer applications. But we can do more than that. We have a continuous stream of medication and biometric information, and we can start to answer questions like, are these medications working? Are they the right dosage? Are they adversely interacting with each other? Should you even be taking this medication? So all of this technology is changing the way that pharma needs to be done. Because old pharma was all based around statistics. If you have a problem, we're going to give you a pill. It'll either fix the problem or fix your symptoms. If you're one of the lucky percentage that it will fix it for. But with new pharma, we're enabling systems that are personalized and use big data to get personal solutions. So you can use behavioral information, adherence information, genomic and lab data, and other sources to help treat the individual person, not the whole population. And the complement to this is systems like PillJogger, which we're going to be hearing about soon, is technology that's creating a new sort of field, encouraging people to engage in their health and form better health habits. And we can do this because now we can passively get this information. We don't require user input. we can know that you woke up, you took a walk, and you took your medications, you exercise like you're supposed to. And if your phone can know this information automatically, we can start to build apps and other systems to incentivize that sort of healthy behavior and get to the preventative side of medicine. So you can use all sorts of incentive mechanisms, from games to social or even monetary rewards. So I think this will start to really drive a revolution, and it's already happening in the consumer space. Devices are being released here to help people live healthier lives, help monitor their medications better. WellnessFX now has something where you can get your blood drawn by them and analyzed on the consumer side, not even through the healthcare field, which is harder to move. But hopefully we can use this consumer revolution and start to move the traditional healthcare field to meet it and match up. That's it.
Okay.
Okay, Louis, I've got quite a few slides, so I'll
Gil's
see if I can do
CTO,
it
so we have two tech people here.
telepathic. Yes, in fact, I'm an electrical engineer too. Are there any engineers in the audience? How many people remember what a fast Fourier transform is? How many people could still do one? Good. Well, I forgot for 20 years, but I've come full circle. We actually have an application for that, which I may get to. But I saw the dark side and went into computer science, and then the really dark side, and went successively into law and then business. But I'm redeeming myself as a technologist at a company that is working on, it's a venture stage startup company that is using software and software applications to encourage people at consumer-facing applications for improving adherence. Now, what does that mean? We'll work on that. Maybe you can just take a look at that. So I'm number 2 there. I'm the CTO and the JD on staff. As you may see, we have a couple physicians. Our CEO's a physician. We have a couple engineers, at least one MBA, maybe some people who aren't admitting to it. And that's more degrees than people, which is what you need in a startup company for sure. And for Pillsbury, that does not mean we're not hiring lawyers. We're all more busy than we can be. So this presentation really is geared to everyone, and I'll try to keep a little bit light on some of the things that have already been covered, because a lot of what I'm saying I think is going to be old news given the presentation so far. But as everyone knows, we do have a problem with adherence. There's an elephant in the room or a bison in the paddock here. Everyone is on medication, or at least the majority of Americans are on medications. It skews towards seniors, but even 25% almost of children, youth, are on at least one prescription medication. Many people are on 2 or more. Polypharmacy doesn't have a fixed definition, but as you can see, as we get older, we often have multiple prescription medications for multiple chronic conditions. And the problem, as we all know, is that people don't take their medications. This chart is somewhat difficult for even me to understand as often as I look at it, but if you pay attention to the blue line, there is a clinical definition of being adherent, that you're taking 80% of your medications properly. And on this particular medication study, one particular hypertensive drug, the rate dropped off from nearly 100% at the beginning to just over 20% after a year. As you can tell, it's a year, so that's a chronic condition, long-term medication. But it's even worse than that because it starts at 100, and as Louis said, 20%, and some sources say more, don't even fill their first prescription. So there's a long-term adherence problem. And the issues that we're addressing are medications for chronic conditions. Certainly there are other problems with narcotics or with elective drugs, but the problem isn't that people aren't taking enough of it. We're talking about the major other 5 conditions that really are responsible for most of the issues financially, and I believe most of the deaths in America, which would be asthma, high blood pressure, congestive heart failure, diabetes, and generally high cholesterol. There are a number of others that also do that. The total cost to adherence problems in America is often given at almost $300 billion per year. I have a few bones with that figure. I think it's too high and too low at the same time, but I'll rant about that later. It's a huge problem. That's not including the lost pharma revenues from people who don't refill or take their medications, the lost business to pharmacies, drugstores, groceries that sell medications, lost productivity, and so on. And it costs many tens of thousands of lives to people who would not necessarily die if they had stayed on the medication. Some of the answers frequently given, there are a number of hard challenges. People who don't have access to medicine, can't afford it, don't believe in the medication, thank goodness people are addressing all of that. We're from a Silicon Valley bent, so we're going to address the low-hanging fruit, or the things that we can address that are more consumer-focused if we can. That can be addressed through behavioral change, through interaction with devices and software and engagement systems. So I'll just show a slide here of what the hard way is. There are medical devices and studies. There's a lot of basic research that needs to be done. Not a lot of people are paying for it. It's very expensive and it's very spotty. We really don't know how people take their medications except here and there. We don't know if people are taking them at work, if they go to the bathroom to drink a liquid, if they truly are taking their medication before or after meals and so on. There's just a lot of stuff we don't need. So we're trying things the new way, things that we can address through software design. If anyone has been on Facebook lately and has 500 friends like you, like I do, you might have seen everyone sending this Wired article to each other about A/B testing. Very interesting data-driven model. Totally interested in proof and evidence, but without a lot of